It is Heart Health Awareness Month, an important reminder not only for February, but all year long. Joining us this morning from UK King's Daughters, we have cardiologist Dr. Hishan Herzala. Good morning to you.
Good morning to you. Thank you so much for having me.
No problem. So let's start by talking what AFib. Explain to everyone about AFib and why does it increase the risk for stroke?
Yeah, sure. Atrial fibrillation is the disease where the top two chambers of the heart is contracting irregularly and at a fast rate. It's a very common disease. We are expecting the prevalence of this disease to be on the rise. Some studies have suggested that about 25% of the people after the age of 70 have atrial fibrillation. Whether they know about it or not, it tends to be asymptomatic without any symptoms that the patient can come up to his doctors or her doctors with. Atrial fibrillation is a very old disease. We know about atrial fibrillation for over 100 years now. And the doctors back then noticed early on that people with atrial fibrillation has higher risk of stroke. Some studies suggested up to 7 times higher risk of stroke. And the reason why this is happening, when the two top chambers of the heart is not contracting fully and regularly, there has to be some stagnant heart flow in these chambers. So what happened with atrial fibrillation patients, they make small clots in the top chambers of the heart, and then one of these clots will just shoot to the brain, block an artery, causing stroke. So it's a very important thing when we deal with atrial fibrillation patients, just to educate them that, hey, it's not only a problem of heart rhythm or rate, it's about stroke. So we always focus on the stroke part of the treatment.
Okay, so let's talk about how someone with AFib could actually try to reduce their risk of stroke. What should they be doing?
All right, so the traditional treatment that has been used for a long time is blood thinners. We started with Coumadin early on, and now we have newer agents that kind of prevent those little clots from forming and subsequently shooting to the brain. So blood thinners has been the mainstay. And what happened with the blood thinners, over those long years, we were challenged by some patients that cannot be on blood thinners or don't want to be on blood thinners. Blood thinners are great. They reduce your risk of stroke, but at the same time, there's a tax that need to be paid. The blood thinners can increase your risk of bleeding in the stomach, in the colon, in the urinary tract, and sometimes in the head. I tell my patients sometimes falling and hitting your head while you're on blood thinners, for some patients, it's a death sentence when you have a very bad bleeding in the head. So, up until 10 years ago, not longer than that, the doctor and the patient would have to sit and decide, okay, are we going to take the risk of the bleeding or are we going to take the risk of the stroke? Because some patients just cannot have a blood thinner. Luckily, today we have a technology that we don't have to have those discussions. If I have a patient that has a high risk of bleeding or a history of bleeding, then we have something to offer them to protect them from stroke without the need of blood thinners and without having to kind of talk about the possible complications of blood thinners.
And what is that? Is it the Watchman procedure?
Yes, this is the Watchman procedure. A group of physicians a while ago, they started thinking, where exactly on the top chambers of the heart are we making those clots before shooting them to the brain? And they found that the vast majority of those clots are forming in a very small pouch right in front of the heart. We call it the left atrial appendage. Truly, there's no clear function for this little pouch in front of the heart, but we found that people are just having clots in there when they have atrial fibrillation before they shoot them to their brain. So a group of physicians and scientists, they invented this device that just go to this little pouch in front of the heart and kind of plug it. No blood goes in, no clot will form, and subsequently people are protected from stroke. Of course, every medical device needs to be tested. Is it safe and does it work? And of course, Watchman was studied by a large clinical trials, and actually we compared the Watchman to blood thinners, and we found, hey, this Watchman is as protective as blood thinners. And actually in a couple of new studies, some studies are suggesting, hey, maybe Watchman is a little bit more protective than blood thinners. So in summary, it's kind of a plug that goes and plug a little pouch in front of your heart where the stroke is usually caused by a clot sitting there.
So talk about how would someone reach out to you guys if they had one of these conditions or they think they might and want to be seen?
Yeah, if you have an atrial fibrillation or one of your loved ones have atrial fibrillation and you're on blood thinner and you're really scared that, hey, I had a bleeding in my stomach or I had multiple falls last year and I'm not sure when is the next time I'm going to fall and hit my head, all what you guys need to do is just reach out to your primary care physician or reach out to our program directly. No referral needed. We just need to talk to you and discuss what's going on. Are you a good candidate for the procedure, and then we move forward. There will be phone numbers here you guys can call, and if you want to learn more about our program, please feel free to call anytime. We have a very well-established program. Actually, last week we celebrated 800 devices since the inception of our program, which is not very long time ago, but we're doing really good. We're getting very comfortable, and we're getting great results, actually.
That's good to hear. Dr. Herzallah, we appreciate you joining us and really good information, not just for Heart Health Month, but for every day of the year.
Yeah. Thank you so much. Thank you for having me.